Are people wanting to come in?
And I don't think there's a waiting room, so. Hold on, let me check something and then I'll share it again. Oh, there's people. Okay. Okay, I'll just give everybody a couple more minutes before we get started. Let me put this back up. Okay. Okay, are you guys ready? We'll just let people trickle in if they want to. Okay, so thank you everybody who is joining us from Jeff's session. This session is called Building Capacity and Improving Access to Care Across IAFCC Clinics. And your speakers for this session are Sophia Housen, Hiba, Adelaide, Allison, Allie, Alexa, and Kate. So if you're just tuning in, the morning has been great so far. We've learned a lot, and now it is my pleasure to turn things over to Sophia, who is going to be moderating this panel.
Okay, hello everyone. I'm Sophia Housen. I am the AmeriCorps VISTA leader with the Illinois Association of Free and Charitable Clinics. I support the AmeriCorps VISTA project with IAFCC, which means that I help clinics create new VISTA positions. I help clinics recruit qualified individuals, and I support VISTA members throughout their year of service. I'm so excited to be here to highlight the amazing work of our AmeriCorps VISTA members, the work that they do, which is to improve access to care among our free and charitable clinics. I have invited 5 of our VISTA members to share their experiences, and I'll introduce them shortly, but I want to explain briefly our AmeriCorps VISTA project. AmeriCorps VISTA, which is short for Volunteers in Service to America, so that's how you get the VISTA. It's a national service organization which aims to improve lives, strengthen communities, and foster civic engagement through service and volunteering. Our VISTA members commit to 1 full year of service with the goal of building the capacity of the organization they are serving with. The federal AmeriCorps program provides them with a small living allowance, and at the end of their service, they are provided with either cash or an education award that they can apply to their grad school tuition. We currently have 14 VISTA members serving in 11 different free and charitable clinics across the state of Illinois. These individuals, they wear many different hats. They work in different areas. So we have some doing volunteer management. We have some working in community outreach and social media. We have others who do data coordination, like monitoring and evaluation. We have some who help fundraise and write grants. And we even have a VISTA member helping to combat the opioid crisis in Illinois. This past year, our VISTA members helped raise over $95,000 in cash. They helped serve over 48,000 individuals, and they reported that 14,000 individuals who are uninsured or underinsured improved their access to healthcare. And they managed and recruited over 1,000 volunteers who collectively performed over 8,000 hours in service. So although we are spread out geographically, we really are a team. We meet monthly and we collaborate amongst ourselves, which has allowed some of our clinics and organizations to build new partnerships that previously wouldn't have existed. So without further ado, I'd like to introduce the 5 VISTA members who are here. Can every panelist introduce themselves, tell us about where you are serving, and give a brief overview of your project? And we can start with Adelaide.
All right, hello everyone. My name is Adelaide Del Angel, and I'm currently the Data, Social Media, and Fund Development VISTA, working at the Old Irving Park Community Clinic. The clinic is located on the northwest side of Chicago, and we serve uninsured and underserved adults throughout the Chicagoland area. There are a variety of services provided by the clinic itself and the volunteers and staff there, which include primary care, behavioral health counseling, and a few other specialty services. And then when we aren't able to provide a specific service that someone is looking for, then we're able to contact others for help. As a VISTA at the clinic, I manage a wide assortment of tasks, though my main focus during my time thus far has been outreach, specifically finding best practices during the pandemic. This includes social media campaigns, mass emails to our volunteers and donor base, as well as initiating new long-term projects like the clinic's newsletter.
Hi, my name is Alexa Beeson, and I'm currently serving at RX Outreach in St. Louis, Missouri as the clinic outreach coordinator. RX Outreach is actually a nonprofit mail order pharmacy that aims to provide accessible medications to those in need by distributing free and highly discounted prescription and over-the-counter medications across the US and in Puerto Rico and the US Virgin Islands. In terms of my project, my main goal has been to develop a clinic outreach plan that assesses the current functions and then also the future needs of clinics, especially free and charitable clinics, and also of their patients when it comes to the affordability of prescription drugs and the relationships that need to be established in order to consistently give those medications to the patients that need them. I've also set a goal for myself of making RX Outreach as a nonprofit medical resource more well-known within the clinic space in order to reach as many patients as possible. And so to achieve some of these goals, my project has been centered on gathering as much information as possible directly from the source. So from free and charitable clinic staff, their patients, and also the patient experience within RX Outreach. And so after familiarizing myself with RX Outreach and the free and charitable clinic networks across the United States, I created and distributed a survey to clinics across rural and urban Illinois that asked about clinic capacity when it comes to providing prescription medications, their patients' ability to afford the medications they're prescribed, and then like what existing partnerships clinics have with our pharmacy or others like ours, and how we as a pharmacy can better serve both the clinics and their patients. So the culmination of my project has been creating marketing materials and a distribution strategy that can be used to make clinics and their patients more aware of the savings that are offered at RX Outreach.
Hi, I'm Allie. I'm the Community Health and Fund Development Associate at Will Grundy Medical Clinic. We are located in Joliet, Illinois, a southwest suburb of Chicago. We are the only free clinic serving the uninsured and underinsured in both Will and Grundy County. Currently, I do outreach in terms of social media management, planning those campaigns and creating marketing materials. I also plan our outreach to donors. So that has involved both relaunching our newsletter over the last year, and then also making sure that they are being thanked in an appropriate amount of time after receiving donations, and also planning our annual appeals and any other fundraising appeals to our donors. I've also created marketing materials and outreach for new programs, volunteer recruitment for vaccine clinics, vaccine signups, and general clinic updates that need to go out to the community. I also work with the clinical staff to help create effective and safe ways to schedule and execute those COVID vaccine clinics that I mentioned previously.
Hi, everyone. My name is Kate Ettinger. I am the Education and Engagement VISTA serving at Community Health in Chicago. Community Health is the largest volunteer-based free clinic in the nation. We have over a thousand wonderful volunteers who donate their time and talents to community health. And we are a leader in delivering comprehensive, high-quality, patient-centered healthcare at no cost to low-income, uninsured individuals. And we are proud to serve more than 8,500 patients every year, providing free medical care, health education, lab tests, and medications. So in my role as the Education and Engagement VISTA, I'm very focused on volunteer management and engagement, mainly our volunteer interpreter program. We guarantee care in English, Spanish, and Polish. So I work very closely with our volunteer interpreter team, recruiting, scheduling, and supporting them through the service with us. I coordinate volunteer onboarding, training, and scheduling for a variety of different types of clinic volunteers we have to ensure we have consistent commitment and quality of experience. I also engage in targeted volunteer recruitment in order to build key relationships to ensure that we have continued growth of our volunteer team and retention. I'm working a lot on volunteer recognition programming this year and enrichment programming. Due to COVID, we've had to move a lot to a remote setting. So I'm very focused on how we can continue to support our volunteers in a virtual setting. As part of this, I've been developing mass communications, including quarterly newsletters, to support our online community and developing new training materials to support our volunteers, providers, medical students, to make sure they have the resources they need. Thank you.
Hi, my name is Emma Pediacal. I'm the Opioid Resource VISTA at IAFCC. So I lead the IAFCC Opioid Project, and the mission of the project is to increase access to opioid use disorder related services for the patients that are served by free and charitable clinics. So this includes educating the community about the opioid crisis, as well as educating the sector about the role that it can play in the opioid crisis. So I've been working on gathering data about what free and charitable clinics have been doing to combat the opioid crisis across the state and country, as well as gathering evidence-based resources for our clinics that they can use with their patients. That includes referral resources, screening materials, etc. And it also just includes educating and talking to staff and providers about the opioid crisis and how they, as healthcare professionals, can work to expand health equity about the opioid crisis.
Okay, thank you, everyone. So I just want to say, if you have any questions for our AmeriCorps Vistas or about AmeriCorps Vista, please feel free to type them in the chat or the Q&A. Other than that, we'll continue on with some more questions. So the goal of AmeriCorps Vista is to build capacity in nonprofit organizations. So our Vistas serve in capacity building projects for a full year, rather than perform direct service like clerical work or manual labor or tutoring. So with that in mind, I wanted to ask Kate, Alexa, and Allie, how are you building capacity at your organization or clinic? And how do you ensure that your project and work will continue once your year of service ends?
Capacity building is a really important and I think valuable part of the AmeriCorps Vista experience. And for me, that means that making sure that my project and the work that I do is sustainable and enduring, and that the things I'm working on will continue past my term of service. So a lot of this looks like making sure that the initiatives that I work on are sustainable, and anybody else could step into my role right away and take them over kind of, without a hitch. So a lot of this means that I'm working on a lot of very detailed process guides so that it's really clear the way that this position should operate. We want to be working very efficiently and making sure that all of our different initiatives are very clear, they're replicable processes, And so a lot of that is I work with my supervisor to think through new ideas about, how is this manageable right now? What would this look like a year from now? What would this look like, with all of these different factors of COVID right now? Can we sustain this in a virtual environment? Can we sustain this in a hybrid environment? So a lot of my work has been focused on that and making sure that, nothing that I do is done in a vacuum. It's done in communication with other departments, with my supervisor, and with the broader goals of the clinic in mind, because we really want the work we're doing here to enhance the organizations moving forward, and make sure that they can continue to use the tools and resources that I'm developing.
Yeah, so my experience has been a little different just because I work at a nonprofit organization instead of at a direct clinic. So there's not really much of an opportunity for me to perform direct service by accident instead of just capacity building. But I think that one of the most important tasks in building capacity at my VISTA site is understanding my organization, where it stands in relationship with other organizations, and how it can be improved to work more efficiently and effectively in the long term for the people that it serves. So at RX Outreach, this means understanding our relationships with our patients, our clinic partners, and our donors to ensure that these relationships are strong and that new ones can develop in the future. And my collaboration with the clinics team, I have learned more about the role that RX Outreach plays in connecting with patients and with their clinics in order to provide those patients with even more savings and a consistent prescription fulfillment system. And then within the marketing and development team, I've learned a lot about how new partnerships are established and old ones are strengthened between RX Outreach and others, as well as how important it is for a nonprofit to position themselves in the online world, especially across social media platforms, on a website, in directly connecting with patients and donors. And so the deliverables for my project will be used long-term as improvements to our current marketing strategy. So I began my time at RX Outreach as an outsider, with a perspective that while I try to learn more about my organization, I can find out what aspects of how we operate and connect with new patients have gaps that need to be filled. So I think that the most important part of capacity building and project sustainability is to focus on filling those gaps while I'm here, so that any other work that I do with RX Outreach doesn't stop once I'm gone after my year of service ends. So one major project that I've been working on is creating a flowchart for patients to use when navigating enrollment at RX Outreach. And I found that when I created an account to see what the user experience was like, it wasn't always super clear what steps I had to take in order to finish my enrollment. So out of this project, I will have created a new detailed PDF guideline that patients can use that describes the enrollment process, the prescription filling and refilling processes, the prescription transfer process, and then also for clinics, the preferred clinic registration and patient enrollment process, because those are a little different. And so I will also be publishing a tear-off pad, like a little succinct version of this for distribution at clinics, so patients can learn more about us like in an actual medical setting. Another huge portion of this project has been creating a new interactive landing page for our website that will allow patients to scroll between the different processes on their own. And all of these pieces will be able to be used far down the line. So even after I'm gone, after my year of service, and that all the work that I'm doing will contribute to any future VISTA's knowledge of RX Outreach and also its relationships.
So capacity building here at the clinic lately has involved growing programs and increasing our outreach to the community through social media and various different marketing materials so that the community is more aware of the services that we provide. So in July, WGMC launched a new program called the Health, Housing, and Hope program. This program seeks to address the social determinant of health in terms of housing and where you live, and health. So housing is, like I said, a social determinant of health. So we're working with other organizations like local homeless shelters and various housing nonprofits to get these people that were identified by the county housed in either shelter, transitional housing, temporary housing, et cetera, as well as providing these people with one-on-one medical case management. So my role in this was, during the implementation of our initial intake, was to create resource packets for our participants. This was a list of local social service organizations that they could provide, that they could reach out to if they needed. I also created flyers and handouts that were both donor and public facing. So these were used in various meetings and discussions with organizations that we were looking to work with. And these were used to portray this program that we were creating as it was continuing to develop. I also, in addition to these materials, I also created and sent out press releases to our news contacts. Building a presence within the community and bringing awareness to our mission has been a really large goal of my project and our organization. And it's been my role to ensure that we are continuing this outreach, especially when we're attempting to build and grow these new programs that are of large benefit to the community and communicating how these do benefit the community in which we are located. Other projects that I have worked on during this last year have included growing our social media presence. So we know that social media plays a large role in how we interact with each other, especially during COVID. So I've been attempting to, through these various marketing campaigns in social media, been trying to recruit new donors, volunteers, as well as maintaining these communications with our volunteers and our donors, just to let the community know what's going on at the clinic and how we're navigating both COVID and regular operations. So to sustain these projects and to make sure that whoever steps into my role after my time, I have been working with the executive director to create a development handbook that will be used by the person that steps into my role. So this will include steps in how to go about executing these projects, where I stopped these projects, and how, along with sorry, I lost my train of thought, how we need to who needs to be reached out to for certain parts of those various projects.
Great, thank you guys. So now I'm gonna ask Hiba and Adelaide. Can you give us an example of a successful project that you each have implemented, and why was it successful for you or your organization?
So one major deliverable from my project was developing an opioid resource toolkit that can be distributed to staff and providers at the free and charitable clinics. So I completed this 15-page opioid resource toolkit full of state-specific resources for specifically uninsured and underinsured patients that our clinics serve. And we have started to pilot it with four clinics across the state of Illinois, which is really exciting. And I think that this toolkit really does speak to the capacity building and sustainability aspect of VISTA service, because my hope for the toolkit is that it'll be used to train new providers and staff about the opioid crisis and what they can do to help combat it as primary care providers at their local clinics, as well as it will continue to develop and be added onto with the newest evidence-based resources after I leave, because I'm developing trainings, like a training so that my successor can continue the toolkit. And it will also provide resources that the clinics didn't previously have to connect their patients to opioid-related services and also substance use-related services. So yeah, I think that that's a really exciting part about being a VISTA, seeing something that comes something tangible that comes out of your service.
So something that I think has been unique specifically about my term of service and that I'm very grateful for is that it overlaps significantly with another VISTA. They had already been working at the clinic for almost a year at this point when I joined. So they had gotten to know the needs of the clinic very well, and we're in the process of working on a lot of different projects. So when I came along, we were able to collaborate and accomplish a lot more than if we had just been working individually. Within my first month of service, we planned and publicized the clinic's first virtual event. This experience was incredibly helpful, especially since I'll be working on this year's event, which will also be virtual. And I feel a lot better prepared for that undertaking because of last year's experience. The event itself included a video of volunteers and the medical director, an interview with him, which has now been added to our website, as well as a silent auction that accompanied it. We ended up raising over $4,000, which initially didn't seem very successful, particularly compared to the clinic's previous events. I think now when you consider all of the obstacles we had to face in trying to make something that could work during COVID, it was pretty successful and honestly surprising that we were able to reach out to so many people. The other Vista and I also worked together to undertake a significant data cleanup project, which is still ongoing even after they've left. And we also collaborated to produce training materials and tutorials for the various applications that we utilize at the clinic, so that anyone could learn how to manage them even after we've left. And these are applications that are utilized by all staff and volunteers in the clinic, so they're going to be especially useful after we've gone. I think the reason that these projects were so successful was the level of collaboration used, and the way these projects have been made sustainable in order to have a lasting impact on the clinic, even as new vistas and other staff and volunteers come and go.
Perfect. So now's when I would look to see if there's any questions in the chat. We haven't gotten many, but someone did ask if your clinic is interested in hosting an AmeriCorps Vista, who can you contact? You can contact me, Sophia Housen. It's just my first name at illinoisfreeclinics.org. At the very end, we'll put back up the slide and my email is right on there. So moving on, if there's no more questions in the chat, let's talk about how our work has been affected by COVID-19, because everyone's has. So I'm going to ask Allie, Alexa, and then Kate.
Sophia, you do have a question now.
Oh, I do.
Yeah, it's has the Vista experience impacted your career decisions and plans going forward?
That's a great question. I will say, whoever wants to answer this, can you answer whether or not the Vista experience has impacted your career decision and plans going forward? I know for a few of you, it definitely has. So take it away.
I can go first. We were just talking about this actually before we started the webinar, but I got my degree in neuroscience from Carthage College. I was pre-med all 4 years of college. I graduated. I was going to study for my MCAT, go to med school fall of 2023. And in becoming a Vista and learning about the underserved population and how free clinics operate and the different policies and advocacy that goes into making sure that our clinics are sustainable and serving our communities. I've now decided that I want to go into a more public policy healthcare advocacy field. So I'm looking to hopefully go to law school in the fall of 2022. I'm not sure exactly how my career is going to shake out, but being a Vista and learning about the work that we do and the work that the Illinois Free and Charitable Clinics does has definitely impacted how I see healthcare and how I see health equity and how healthcare is delivered to every person that lives in Illinois. So I'm very excited, but yeah, for sure changed my perspective.
I can answer this one too. So I actually had that like coming to knowledge moment, and when I was still in undergrad, I went in as pre-med, and then I switched to be an anthropology and classics double major, which is pretty far off of pre-med in the first place. But I think being an AmeriCorps Vista really solidified the fact that I also want to go into public policy, specifically health policy, and just working within a nonprofit organization, seeing how much need is still existing in the United States, just even during the pandemic. Like, we can try as hard as we possibly can to reach as many patients as possible, but there's still like an overarching systematic issue with our healthcare system that I would like to address professionally. So I plan on going to public policy school after completing my year of service.
And then I guess going off that, is there anyone who, you know, their year of service has solidified their career plans? Hiba, I'm thinking about you specifically.
Yeah, so I graduated pre-med as well. So I applied during my VISTA year, and I am attending the University of Michigan Medical School in the fall. I think that this year really solidified the kind of work I want to do. I knew that I wanted to serve underserved populations, and I think working in a like a nonprofit has really shown the complexities of serving people that are uninsured and the big gaps that exist in our current infrastructure as a country. I'm really interested in getting a dual MD MPH, and specifically probably specializing in epidemiology, because I've seen like a lot of gap in data, specifically in free and charitable clinics, and that really just shows how inequitable a lot of things are, because the patients that free and charitable clinics serve are really the demographics that we want to uplift when it comes to health equity work. So yeah, this has definitely shaped the kind of physician I want to be.
Great. And the chat is always open if you have any more questions, but we'll keep going. So talking about the pandemic, I want to ask Allie, Alexa, and then Kate, how has the pandemic affected your work projects, and how have you incorporated pandemic efforts into your work?
Yeah, so when I started as a VISTA, the clinic was actually closed to the public. And given that we provide care to vulnerable and in a very high risk population for both COVID and other chronic diseases, it was important that we developed a plan that would allow us to reopen, but in a safe way for both our staff and our patients. So when I first began at the clinic, we wanted to onboard a telehealth service platform. So my responsibilities with this project was vetting various platforms, scheduling demos. When we finally landed on one, creating training materials and scheduling those trainings with our telehealth platform. I also created materials informing patients on what they needed to do in terms of using this new service. And then during the last 2 months, we have began administering vaccine here at the clinic. So in terms of how I've been involved in that, I have created intake materials for patients, a clinic flow sheet to make sure that there's no bottleneck effect during these clinics and that we're not having overcrowding in certain areas. I've created signups for both volunteers and patients, appointment reminder forms to make sure that our patients are coming back and remembering that second appointment that is so vital, because we are currently distributing the Moderna vaccine. I've also trained various staff members and volunteers on how to schedule these patients in the system that we are using for this appointment. And I also have created information sheets about the vaccine to give to patients. Along with this, I've also made sure to continue to share this on social media, because it's important that we show the public that we are involved in this pandemic. We are committed to combating this pandemic and mitigating the spread of this disease, and making sure that we are protecting our patients and the community and getting these people vaccinated, as well as we have been providing testing, so letting them know where they can get tested, whether it be at the clinic or at the local health department or other locations. And I've also been keeping our website up to date with vaccine dates and sign up links.
Yeah, again, so my experience has been a little different from Allie's due to working like in an office setting instead of directly at a clinic. But the pandemic has obviously been hard on all nonprofit organizations since the onset of the pandemic last March. So I think a really huge portion of reacting to the pandemic has been navigating working from home while learning from scratch about RX Outreach, its operations, how I fit into my project, and just like overall connecting with my colleagues and with other organizations that might have happened in person otherwise. So it is always a challenge for me as a new employee to learn about a project on my site that's happened in past internships. It obviously is happening now, but it's definitely been compounded by the pandemic, as well as the time constraints of only serving at RX Outreach for a year. And part of this too has been how working from home has impacted my project. So as I mentioned in my introduction, a huge portion of my project has been collecting data straight from the source, that is like from free and charitable clinics across Illinois and the rest of the country, who are some of our biggest partners. And in a perfect situation, I would have wanted to go and visit some of these clinics to learn more about how they operate, maybe meet some of the patients that they serve, as well as hear real stories from real people about the needs of their clinics and how their clinics need more affordable prescription medications and like how I could fit into that. So I think that collecting information from a multiple choice survey like I did is very difficult, especially instead of being able to speak with someone in person and see the clinics for myself. So it has also meant with the pandemic that there's a strain on a lot of my colleagues in the office who are not only having to focus on their normal duties as where they would be in the year in the office, but now they also have to focus on new projects and fulfilling new grants and clinic signups that are centered around COVID. And one way that the pandemic has affected my project in a pseudo beneficial way is it has become a lot more apparent that a place like RX Outreach is necessary now more than ever. Because usually we serve people who fall under 400% of the federal poverty line. But with COVID, we actually expanded to serve anyone affected by the pandemic, which made a lot more patients available to RX Outreach. And with more people losing their jobs or their financial security or even their loved ones, there's a lot of more people now in need of these kinds of nonprofit medical resources. So this has really given me a sense of passion in completing my project as best as possible, while also trying to be as expeditious as I can to ensure that no patient is left behind during my project or during my year of service. And it's also meant that I have had to pivot my focus of my outreach plan to center it on patients that are affected by COVID-19, which is a much larger group than originally served by RX Outreach. And also with the closure of so many clinics during this time, it's meant that I have had to research other organizations, especially things like places of worship, school nurses, community centers, community-based groups, town halls, in order to reach more patients who might be wary of contracting COVID at a typical medical setting or whose local medical settings have been closed, in order to reach these patients and inform them about RX Outreach.
Yeah, similarly to Ali and Alexa, my project has obviously been impacted a lot by COVID. Because I'm serving largely in a volunteer management role, I would say a lot of my focus has been on maintaining volunteer support and engagement as we have moved to a very virtual service setting. Obviously, we still have volunteer providers who are coming on site, but our interpreter team, which I manage, used to come on site to interpret in person when the pandemic hit. Before I was on the team, but we had to move that to be completely remote. So now I am managing their interpreter program remotely, which means that this is all phone interpretation. And we were worried about losing the sense of community and connection that the volunteers would feel being in person. So I've really been focused on enhancing our virtual engagement and enrichment initiatives. And this means that I brought back a lot of, it's been very communications focused, and I brought back a lot of types of communications that we were able to focus on before the pandemic, but didn't have the capacity to before we had, a VISTA serving. So I've brought back, we have a quarterly newsletter for our volunteers, letting them know all the great clinic updates, giving a lot of shout outs to volunteers who've been really wonderful. I brought back monthly volunteer spotlights where we get to do little interviews and highlight some of our really wonderful dedicated volunteers, as well as we now celebrate a volunteer of the month every month, just somebody who's outstanding service, really stood out to us. So I think that's been a really important part of my job because of COVID, is trying to make sure we can continue these relationships and we can continue to have high volunteer retention and also grow our team. So I focus on recruiting and onboarding new volunteers every month. And in March alone, I brought 8 new volunteers onto our team who in that month already contributed 50 hours of service. And in March, I managed nearly 200 volunteers who collectively served for 1,516 hours. So we have a very strong, very robust volunteer team. We're very proud that we, since the pandemic, have not had to cancel any patient appointments due to a lack of interpreter support. So we've always been able to maintain that for our patients. And so this has been a really strong focus, is making sure we still have that volunteer support. In addition, there are some other ways that I have been focusing on my efforts to support the community health team throughout COVID. One of these is we're introducing a few new volunteer roles. So in order to get volunteers a little more practice that they usually would have gotten in person, I've started a volunteer engagement club. We have our first meeting in a couple weeks to provide a space for our volunteer interpreters to practice with one another, discuss best practices, ask and answer questions. And I've created some new roles where they can help facilitate training. We really have a strong train the trainer model. So some of our very experienced volunteers conduct monthly trainings for new volunteers, which is really wonderful because it allows them to connect with our newer volunteers and pass on their wisdom. So I've been really focused on that. And in addition, we are also running vaccine clinics on site, which we're very excited about. And so we have needed volunteers for that. And I've been supporting my supervisor in making sure we recruit and have the people we need for that. So making sure we have the Spanish and Polish interpreters we need, making sure that we have the right amount of flow volunteers on site and everything. We've also moved to telehealth, a hybrid telehealth model. So we still have many on-site appointments, but we have been using telehealth over the past year, which has been a really good opportunity to expand access to care. And it means that patients, save on transportation and childcare costs when they don't have to come all the way into the clinic. So I've supported that by kind of communicating its nuances with providers and volunteers. And in addition, have been coordinating translation efforts for different documents that I work with different departments if they need, a document on how to use telehealth for our patients, translate it into Spanish and Polish. I work with my volunteer team to make sure we can get that out. So making sure all of our vaccination flyers and information are in Polish, Spanish, English. We just opened a new microsite, which is exciting, making sure all of that's in multiple languages. So that's really been my focus throughout.
Perfect. And we actually got a really good question in the chat, kind of in line with what I was going to ask next anyways. But we have the question, which is, when you started your VISTA service in the free clinic setting, was there something you had assumed or thought you knew, but then throughout your year of service learned it was the opposite of what you initially thought? That is a really great question. I was going to ask, why did you decide to become an AmeriCorps VISTA, and why specifically did you choose your project and site? And then I'll ask Adelaide and Hiba that, and then if you guys can follow up with maybe something that you learned that was the opposite of something you came in initially thinking.
All right, so my story is definitely similar to those you heard from the other VISTAs during the Q&A session initially. But I graduated from university in May of 2020. And because of everything that was going on, I honestly had no idea what I was going to do. So I had initially made other plans, but decided that they weren't going to be possible because of the pandemic. I'd been a pre-med in college studying molecular and cellular biology. So I decided just very generally that I'd like to do something in healthcare in Chicago, since that's where I grew up. In my last couple of years of college, I had been questioning a lot whether I wanted to go to medical school or if I should pursue public health as another path. I decided that finding a job for a year that could expose me more to public health and the public health sector would be most beneficial. I found the listing for IAFCC through AmeriCorps and essentially stopped looking because it sounded like the ideal opportunity. I spoke with 2 people on the phone who are now my supervisors at Old Irving Park Community Clinic, and then started my term of service this past August. Because of my time with the clinic, I'm now positive that a career in public health is the right choice for me. So I'm currently looking into graduate school programs focusing on public health and or bioethics with a focus in research. So it's definitely been an enlightening experience, to say the least, in both my personal and professional life.
So I have, I guess, a kind of a similar story, but in undergrad, I was a chemistry major. So a lot of my activities were kind of like entrenched in academia. But then I did volunteer with a mobile free clinic in Boston. And even I saw that, like, even though Boston literally has the most hospitals per capita, there were so many communities that weren't being served. And I think that really highlighted what I wanted to do as a future healthcare provider. I wanted to serve the most marginalized and underserved communities. So I started looking for like years of service for my gap year, something that would educate me and make me a better future physician and medical student. So when I saw the IAFCC listing for like coordinating a project addressing a major epidemic in this country that disproportionately affects people who are economically disadvantaged, that's really what I wanted to do. And focus on the people that really don't have the access to the expensive rehabilitation facilities and treatment services that maybe other people do. So that's why I chose my project.
Okay, and then we had another question. So after getting an inside look at free and charitable clinics, do you have any new ideas for ways that we can further use VISTAs? Yeah, if anyone wants to answer it, we have about 5 minutes left.
I really quickly, Sophia, if you don't mind, like wanted to touch on the other question about like if I thought I knew something and then it was the opposite. Personally, I grew up less than 20 minutes from my site, and until I started looking at VISTA positions, I had no idea this place existed. So I think that's the one thing that kind of, I guess, like, it's not the opposite, but it always surprises me like how not known our services are, and kind of how difficult it is to kind of make us known, because we do provide services to a very large population, and the fact that it's not our services, you know, kind of get overshadowed by other like larger nonprofits sometimes in the community, kind of really surprised me. And the other thing I will say on that too is that we here have a really hard time sometimes finding providers and specialists that want to work with us, which was another thing that kind of surprised me. So yeah, just realizing the capacity that the huge population we serve and how underknown it is was kind of surprising to me. And I don't know if that was an experience of you guys as well.
Yes, I totally agree. Thank you for that. It's a really good piece of insight.
And I just wanted to touch on the potential roles of VISTAs in the clinics. I think as far as that is concerned, there truly is no limit to what the VISTAs can be focused on, because at least I know for myself, I basically just address whatever is needed, whatever anyone tells me needs to be done for the clinic. So if you can think of a project that needs to be done for these clinics, then a VISTA could handle it. So it really is a tool for these clinics.
Yeah, I agree with Adelaide, and I was just gonna say, I think, really utilizing VISTAs in ways that they're interested in. We all come in with very different backgrounds. I don't have any sort of medical background, like I didn't study pre-med or anything. And so I have like just different natural like interests and things that I worked on through college and like to focus on maybe slightly different areas. And so I think just really being able to communicate with your VISTA and the whole team and everything, what are their interests, what are they like really good at, and how can you use that to improve your clinic? I think this has been, VISTA service for me has been a really meaningful opportunity to work with people who share the same value for service that I do, from the amazing team I work with at Community Health to all of my fellow VISTAs. I think it's been very kind of grounding to work in alignment with my principles throughout the pandemic, and humbling to be part of such a committed team. And so I think just like communicate with VISTAs about what they're interested in. And you'll see a lot of new opportunities arise for your clinics, because we have such diverse backgrounds in our interests, and I think have a lot to offer in just different ways.
Great.
Yeah. Oh, sorry.
Sorry,
Sophia.
we're running low on time. We have a few more questions. But I'm going to ask Emily to pull that slide back up on the screen so that everyone can see all of our beautiful pictures. While she's doing that, I will just say that, our Vistas, they're mostly college graduates, fresh out of college, and they come with a lot of really great innovative ideas. They know how to use technology, the newest forms of technology, and also they're a fresh set of eyes into your organization. So they can help, I feel like my best advice is to use your Vistas is to trust them with the ideas that they have, because they do know a little bit about some things, but they do have a fresh set of eyes and new perspectives on how they can improve some projects. I am just going to ask, because we only have about a minute left, to share the Summer Associate Program. So we have all been talking about full year Vistas, and that is one project that IAFCC is implementing, but we actually got approached recently by AmeriCorps to implement a Summer Associate Program. So it's basically the same idea of AmeriCorps Vista, but it's on a much smaller scale, where you can have a Vista at your clinic for 8 to 10 weeks during the summer, and they can work in either capacity building or direct service volunteering activities. This is geared mostly for COVID-19 activities. So I will just say that if you are interested in hosting someone over the summer, you can email me. I think my email's already been put in the chat, and we can set that up. And while people are leaving, we can answer one last question. What marketing or promotional tools besides social media have you created or used to promote your clinic?
I personally, if anyone else wants to answer this, they can as well. But personally, I reached out to all of the Rotary clubs that were in the area, and we did presentations at various different Rotary clubs. And then I also had the opportunity to present on my VISTA experience with my alma mater. So just raising awareness about the projects that we're doing, especially in the community and with other nonprofits, I feel like was really beneficial. And then I created little handouts that had all of our social media tags on them and passed them out to members. And then if the meeting was virtual, we emailed it out to the president. So that was a great way to kind of raise awareness for the clinic.
And I will take these remaining questions and ask them among our VISTA members and then send them back to you. Okay, Emily, if you want to close us out.
Yeah, I just wanted to say that was a great conversation between all of you guys. I wish I could be a Vista. But so we're gonna have a break right now, a 10-minute break, and we'll be back at noon. I just put the link for the next Zoom session in the chat. If you want to go ahead and join there, you can put yourself in the waiting room and then get up, stretch your legs, take a break, or just join it at noon is when we're starting the next one, just for some quick closing remarks. And if you lose that link, you can refer back to the agenda that I sent you all in an email on Friday. But so yes, thank you, Sophia and Hiba, Adelaide, Allie, Alex, Kate. You guys were all great. Great session. Thank you.
Thank you.
Thank you all.